Great honor to start the closing, right? And our closing speaker today will be Dr. Sonia Sachs. And for those of you who know her, no words can express how kind she is. For those of you who don't know her, a very special thing is that, you know, when we started talking about the United Nations Millennium Development Goals, the MDGs, everybody was looking for multiple magnificent creative initiatives that can be created to help actually evolve the MDGs, and question as to whether they could be accomplished anyway, as you know. And one person who has taken a tremendous initiative toward definite accomplishment of the MDGs is Dr. Sonia Sachs. So in brief from her bio, though you can see it on your paper there, she is the director of the Millennium Village Project, mostly in sub-Saharan Africa, where she oversees all health-related interventions and research. And most importantly, though it's in your documentation there, she says that the Millennium Village Project is proof of concept. It's very important, proof of concept that extremely poor rural communities can reach the Millennium Development Goals given a science-based, community-led approach of integrated interventions that increase food production and increase access to healthcare, education, water, and infrastructure. And the goal is to show that such an integrated development approach is both scalable and sustainable. Dr. Sachs is a pediatrician, endocrinologist, and a public health specialist, and she is a very special person. Ladies and gentlemen, it's my honor to introduce Dr. Sonia Sachs.
Thank you so much. Possible for you to put the screen? Perfect. I appreciate that you stayed to hear this presentation. There is a lot I would like to discuss about the MDGs and the Millennium Villages Project, which we do, thank you, think of as a demonstration of how Millennium Development Goals can be reached even in the most despondently poor areas of Africa. But I actually wanted to think about it with you through the lens of the water issue, which has been the subject of the 2 days with a lot of august faculty and participants. So I wanted to discuss with you the Millennium Villages Project and Millennium Development Goals, but through the lens of water. And it's not only my allegiance to my in-house economist that I say that there's no question that the water is a crucial element for economic development. The Millennium Villages is, as Dr. Felder was saying, a proof of concept that the Millennium Development Goals can be reached. At this point, we are situated in about 10 countries, actually it's almost 20 at this point, but 10 countries where we are very closely monitoring the whole process. And the 10 countries are both East and West Africa, and the sites within those countries have been chosen to represent the hunger hotspots of each of the countries. So by definition, they have the worst social indicators. Specifically, stunting in all of these regions is about 40%. What I wanted to discuss with you is that although the Millennium Development Goals and therefore the Millennium Villages is a proof of concept that you can reach them if you do them in conjunction with each other, if you basically do a package of integrated interventions, that you don't just deal with water or just deal with health, but that a community, like any thriving metabolic organism, needs all of the components. That if you want the community to thrive, you really do have to help them with access to increase food production, access to water, health, education, and also business development. But in spite of the fact that the whole point of the Millennium Villages projects, which is to show that it can be done community-based, community-run project, agriculture really is a sine qua non. So although we're talking about the fact that you have to do all of the interventions at the same time, agriculture is absolutely the most critical, because if the population cannot feed itself, and have a surplus with which to start saving and then investing in their own development, then the rest would not follow. So if you look at all the countries that we work in, all of them basically are agricultural societies. And shockingly for me, when I looked it up, 85% of the water consumption is used for agriculture. So therefore, the water component, since agriculture is absolutely the central pillar, food production, nutrition, is a central pillar, water, which 85% of the water consumption is used for agriculture, really is critical. And of all the sites that we work in, there are a couple sites that there are no water shortages. And so there, the communities have been able to show that with a little bit of irrigation, small-scale irrigation mechanisms, with high-yield variety seeds, and with fertilizer, in fact, they have been able to double, triple, quadruple their yields, their harvests. And so they're also multi-cropping and really are basically thriving. Then there are regions in sub-Saharan Africa that are in much drier climate, and there frequently the rainfall is less predictable, and often actually there is a failure of the rainfall. There is a complete drought, often of the second season or even just the main rainy season, and then there is less access to irrigation. And in these areas, in these dry areas, the water management, rainwater management, is absolutely critical. And then we also have some regions in the drylands area, which is represented by regions that I would like to talk about. One is in northeast Kenya, a region called Dertu. It's very close to Somali border, and it's basically a pastoralist area, and it's completely dry. Another one is Koraro in Tigray province in Ethiopia, which is also a very dry region, and another one in Senegal, Potou, in Senegal. And these dryland regions are characterized basically by very frequent crop failures and extreme hunger. They also are characterized by heavy disease burden, low population densities, which is a problem when you're thinking of delivering services. So the drylands really are the toughest regions, and yet they're the ones that we really have to focus more than anything, more than any other areas, because they are noticeably the areas where the failed states exist, and there's definitely a correlation between the extreme poverty there and the civil unrest. Based on our experience in the drylands region, which I would like to show you momentarily, based on our experience and best practices, Jeff and his colleagues and I have started a drylands initiative just in January of this past year called the Dryland Initiative, which is an initiative that's been co-sponsored by COMESA, the Common Market of East and Southern Africa, and also of UNCCD, the UN Secretariat for Convention on Combating Desertification, and Columbia University. And so the Dryland Initiative, we had a meeting in January with the ministers of health and agriculture and finance of Sudan, Eritrea, Ethiopia, northern Uganda, Uganda because of the northern Ugandan region, Kenya because of the northern region, which is in the drylands, Somalia, and Djibouti. There are other dryland regions, of course, in West Africa, but this particular initiative is focusing on the countries that in East Africa that have this particular common theme of extreme difficulties with agriculture or livelihoods because of the extreme dry circumstances. So, and by the way, the point of the Dryland Initiative is just that it behooves us to think of the problems in a collective way, so that, for instance, you can make some regional assessments of weather predictions, regional strategies, and regional policies. So this is an effort to try to address the these water deprived areas in a more regional collective way.